Some estimates show that as many as 40% of us spent this past week making resolutions concerning our behavior for the new year. Maybe we want to get in shape or to be a better friend. Well, for up to 800 folks here in Wisconsin, if they resolve to quit smoking in 2013, they may now have the opportunity for some help. Dr. Michael Fiore runs the UW Center for Tobacco Research and Intervention. He joins us now to talk about a new multi-million-dollar grant to help Wisconsin residents stop smoking. Dr. Fiore, thanks for being with us.
Happy to be here.
Talk to me about the plans for this money that's coming from the National Institute of Health.
Well, the $10 million grant is going to do three things. It's going to identify smokers who will get free coaching. They'll get one of a series of free medications and a whole series of health tests, all with a goal of first identifying the best treatments to help people quit, but then to look at the health benefits of quitting. There have been few studies over time that have followed people who have successfully quit to see exactly what we can tell smokers in terms of the benefits you'll experience as a result of quitting.
You and I were talking before. It just seems intuitive that you would think, well, if you stop, you're going to feel better. But empirically, the data is just not there to prove that yet?
Well, you know, we have groups of people that smoke, groups of people that are non-smokers, those who have quit, but we haven't followed people over time so we could actually track the differences. So we'll have more than 1,500 smokers who will do a bunch of sophisticated lab tests at baseline, at 3 years and at 5 years, and we'll be able to document in the most sophisticated way that's been done thus far what are the benefits of quitting.
This is a continuation of a study that you've been doing here at the university. I guess, why have you been able to be so successful in helping people quit, whereas maybe they had tried and failed in the past?
Yeah. Well, we know that most people in Wisconsin today want to quit. In fact, 8 out of 10 say, I wish I never started. They've already tried to have quit. Most, though, try cold turkey on their own. The success rate there, less than 5% over time. In contrast, if you see a doctor, take advantage of the Wisconsin Tobacco Quit Line, or join a program like this research study, you could boost that success rate to 20, 30, even 40%. So the impact of treatment, science-based treatment, is dramatically improved.
You mentioned at the beginning this study will offer coaching. I found that intriguing. Explain what you mean by individual coaching.
Yeah. Anybody who's tried to quit knows that it is a miserable process, and unfortunately we don't have any magic even as part of this program. But what we can do is have a person working with you side by side at the start, providing you social support, giving you science-based tips, be available if you're having a tough moment. And what we've found that with this sort of one-on-one coaching, it really boosts success.
When we're talking about success, how often will people start and then fail and then start again? And I mean, how many times does it take?
Yeah. You know, smokers are individuals, and some quit on their first time, some take 20 or more times. The average is about 5 to 7 times. But here's the key message. No matter how many times you've tried, no matter what method you use, the best thing you could do to improve your health is to quit. This program is a wonderful way to do it. There's lots of others, but if you're interested, we'd love to work with you.
Got about a half a minute left, but I wanted to ask you, how big a problem is this still in the state of Wisconsin?
Well, today in Wisconsin, about 19% of adults smoke. That's great progress from more than 40% in the 1960s, but we've got a long ways to go. We've got almost 1 million adult smokers in our state. They're also very expensive. They have health problems that cost our state almost $1 billion in added health care costs. So we need to do more at the state level with the Wisconsin Tobacco Quit Line and other programs to help them to quit.
I'm going to have an opportunity to do that with this new grant. Thank you so much, Dr. Fiore, for joining us. If you are interested in participating in this study and quitting smoking, we're going to have the link to where you can sign up on our website, wpt.org/here and now. Again, that is wpt.org/here and now. Here and now is all one word. That is